And I would say that the challenge with health spyware is that if you think about how much information we can glean from electronic data versus what it really takes to understand and assess someone's health and behavior, the electronic data is very limited. It isn't sufficient. It's very difficult to know why someone's blood sugar is high. They may have an infection. They may have a viral infection, which can raise or lower blood sugar. They may have a bacterial infection. Um, it could be just many other things that affect blood sugar, and so knowing things like that usually addressing things like that requires additional information. You have to speak to the person, look at their environment. Maybe it's a diabetic patient that requires insulin and they're unable to give themselves their own shots because their vision is poor and they can't see the syringes. So, I'm not sure how effective it would be to have health spyware that only use electronic information. I mean, it's what we do today in terms of surveillance, but it's not enough to assign causality or blame or anything else. It's just enough to provide a signal that one has to dig in and investigate further. Now, if you fast forward maybe 10 or 15 years when Internet of Things is pervasive or medical Internet of Things is pervasive, we probably will know a lot more. We'll know whether someone is walking around, getting out of bed, walking stairs, actually exercising, whether they've opened their refrigerator or not, have they opened their pill bottle, and not only have they done it, but we'll be able to integrate that information. More of that NSA perspective that you're proposing of total information awareness, as they used to say, but I guess the program was politically incorrect and had to be given a new name. We're moving in that direction. My concern is not that monitoring will occur inappropriately. I think it's the kind of monitoring that we need in order to help provide guidance for optimum health care for the sake of the patient and for the sake of the cost of health care in general. It's possible that someone will use it inappropriately, but I think if it becomes available, if it becomes reliable and mainstream, it will be used in an appropriate way.